Question 1. A social worker receives a subpoena for a client's records. The client has not provided consent for the release of information. What is the first action the social worker should take? A. Immediately release the records as legally required by the subpoena. B. Contact the client to discuss the subpoena and obtain informed consent for release. C. Consult with an attorney or agency legal counsel regarding the subpoena. D. Inform the court that the records cannot be released due to confidentiality. Answer: B. Contact the client to discuss the subpoena and obtain informed consent for release. This question tests your understanding of confidentiality and legal processes, specifically the first step when a subpoena is received. The most crucial initial action is to prioritize the client's rights by discussing the subpoena with them and seeking their informed consent to release the records. While legal consultation is important, the client's right to confidentiality and self-determination must be addressed first. For example, a client might prefer to object to the subpoena, which they have a right to do, or they may consent to a partial release of information. Remember, always start with the client when their confidential information is requested, unless there's an immediate threat of harm that overrides it. Question 2. A social worker in private practice is experiencing significant financial difficulties and considers accepting a gift of substantial value from a long-term client who expresses gratitude for the social worker's help. What is the best course of action for the social worker? A. Accept the gift, explaining that it helps alleviate financial stress, and continue therapy. B. Decline the gift, explaining that professional ethics prohibit accepting gifts of significant value from clients. C. Accept the gift but immediately refer the client to another therapist to avoid a dual relationship. D. Accept the gift and document the rationale in the client's file, while ensuring no impact on treatment. Answer: B. Decline the gift, explaining that professional ethics prohibit accepting gifts of significant value from clients. This scenario addresses ethical boundaries and conflicts of interest, prompting you for the best action. Accepting a gift of significant value can create a dual relationship, compromise professional objectivity, and potentially exploit the client, violating ethical guidelines. The social worker's personal financial struggles should not impact professional boundaries with a client. Declining the gift while clearly explaining the ethical rationale upholds professional standards and protects the therapeutic relationship. For instance, if a client offers an expensive car, accepting it would undoubtedly blur the lines of the professional relationship. Always prioritize maintaining clear professional boundaries to protect both the client and the integrity of the therapeutic relationship. Question 3. A social worker is conducting an initial assessment with a client experiencing homelessness, severe depression, and suicidal ideation with a specific plan. What is the most immediate priority for the social worker? A. Developing a long-term housing plan. B. Exploring the client's social support network. C. Assessing and ensuring the client's safety. D. Referring the client to psychiatric services for medication. Answer: C. Assessing and ensuring the client's safety. This question focuses on crisis intervention and risk assessment, specifically identifying the most immediate priority. When a client presents with suicidal ideation and a specific plan, the paramount concern is always their immediate safety. All other issues, such as housing, social support, or medication referrals, become secondary until the imminent danger of self-harm is addressed and mitigated. For example, you wouldn't discuss long-term goals if the client is at severe risk of harming themselves within the hour. Always remember that safety, especially when there's an immediate threat of harm, is the absolute first concern in any social work intervention. Question 4. A 16-year-old client, who has been attending individual therapy for anxiety, confides in the social worker that they are pregnant and do not want their parents to know. What is the next step the social worker should take? A. Respect the client's confidentiality and continue therapy without involving the parents. B. Immediately inform the client's parents, as the client is a minor. C. Discuss with the client their options, legal rights, and confidentiality limitations regarding their pregnancy. D. Refer the client to an OB/GYN without parental consent. Answer: C. Discuss with the client their options, legal rights, and confidentiality limitations regarding their pregnancy. This question deals with confidentiality with minor clients and addresses what the next step should be in a sensitive situation. While the client is a minor, many jurisdictions grant minors certain rights regarding reproductive health decisions and confidentiality. The social worker's role is to empower the client by providing information about their options, understanding the legal framework concerning parental notification in their specific state, and clarifying the boundaries of confidentiality. For example, the social worker should explore what the client's fears are regarding parental involvement. Always ensure the client is fully informed about their rights and the potential limits of confidentiality before proceeding with any action. Question 5. During a group therapy session, a member consistently dominates discussions, interrupts others, and offers unsolicited advice, causing other members to become withdrawn. What is the best way for the social worker to intervene? A. Ask the dominating member to leave the group session temporarily. B. Address the dominating behavior directly and facilitate a discussion on group norms and respectful communication. C. Ignore the behavior, hoping it will resolve itself over time as the group develops. D. Assign the dominating member a specific task, such as note-taking, to redirect their energy. Answer: B. Address the dominating behavior directly and facilitate a discussion on group norms and respectful communication. This question focuses on group dynamics and the best intervention strategy for a disruptive member. As the group facilitator, the social worker has a responsibility to maintain a safe and productive environment for all members. Directly but gently addressing the behavior, linking it back to the established group norms, and inviting a discussion encourages self-awareness in the dominating member and reinforces respectful communication for the entire group. For example, the social worker might say, "I've noticed some members haven't had a chance to share. Let's revisit our agreement about ensuring everyone has a voice." The goal is to correct the behavior while maintaining group cohesion and therapeutic progress. Question 6. A social worker observes that a client consistently attributes their academic failures to unfair teachers and biased grading, despite evidence of poor study habits. This client is likely employing which defense mechanism? A. Sublimation. B. Rationalization. C. Projection. D. Displacement. Answer: C. Projection. This question tests your knowledge of defense mechanisms. The client is attributing their own unacceptable thoughts or feelings, poor study habits and responsibility for failure, to another person or external source, unfair teachers, biased grading. This is a classic example of projection. Rationalization would involve making excuses that sound logical but are not the real reason, whereas displacement involves redirecting emotions to a less threatening target. For example, instead of accepting they didn't study, the client blames the teacher's grading, effectively projecting their fault onto someone else. When a client blames others for their own shortcomings, think projection. Question 7. A new client presents with symptoms consistent with a major depressive disorder. After conducting a thorough biopsychosocial assessment, what is the next step the social worker should take? A. Immediately refer the client for electroconvulsive therapy, ECT. B. Develop a treatment plan focusing solely on talk therapy. C. Discuss potential treatment options with the client, including the possibility of medication and therapy. D. Contact the client's family to inform them of the diagnosis and treatment recommendations. Answer: C. Discuss potential treatment options with the client, including the possibility of medication and therapy. This question focuses on the next step after an initial assessment for depression. Following a comprehensive assessment, the most client-centered and ethical action is to engage the client in collaborative decision-making about their treatment. This involves discussing various evidence-based options, such as psychotherapy, pharmacotherapy, medication, or a combination, and allowing the client to make an informed choice based on their preferences and circumstances. For example, the social worker might explain cognitive behavioral therapy and also mention that a medical doctor can assess if antidepressant medication is appropriate. Always empower the client by providing them with information and involving them in the planning of their care. Question 8. A client with a history of substance use disorder relapses after several months of sobriety. The client expresses intense shame and indicates they do not want to continue treatment. What is the best response from the social worker? A. Remind the client of the negative consequences of their relapse. B. Encourage the client to view the relapse as a learning opportunity and recommit to treatment. C. Terminate services, as the client is no longer motivated for change. D. Refer the client to a higher level of care immediately. Answer: B. Encourage the client to view the relapse as a learning opportunity and recommit to treatment. This question tests your understanding of relapse prevention and motivational interviewing, asking for the best response. Relapse is often part of the recovery process, and it's critical for the social worker to normalize the experience, reduce shame, and reframe it as a chance to learn what led to the relapse and strengthen coping strategies. Focusing on continued engagement and support is key. For example, instead of judging, the social worker might ask, "What did you learn from this experience that we can use to strengthen your recovery plan moving forward?" Always emphasize that relapse is a setback, not a failure, and continued engagement is vital. Question 9. A social worker is facilitating a support group for survivors of domestic violence. One member consistently offers graphic details of their past abuse, which appears to be triggering for other group members. What is the best intervention by the social worker? A. Allow the member to continue, as it is part of their healing process. B. Directly interrupt the member and tell them their sharing is inappropriate. C. Gently redirect the member, reminding them of group safety and boundaries, and suggest individual processing for graphic details. D. End the group session prematurely to protect the other members. Answer: C. Gently redirect the member, reminding them of group safety and boundaries, and suggest individual processing for graphic details. This question involves group facilitation and creating a safe environment, asking for the best intervention. While sharing is important, the social worker must balance an individual's need to express themselves with the safety and therapeutic needs of the entire group. Graphic details can be re-traumatizing for other members. The social worker's role is to gently but firmly guide the conversation, reiterate group norms about sensitive content, and offer to process such details in a more appropriate setting, such as individual therapy. For example, the social worker might say, "Thank you for sharing, but to keep the group safe for everyone, let's keep details general, and we can discuss this further in individual session if you'd like." Always prioritize the safety and well-being of all group members. Question 10. A social worker suspects a 70-year-old client, who lives alone, is being financially exploited by an adult child who recently moved in. The client expresses fear of retaliation if the social worker reports the abuse. What is the first action the social worker should take? A. Report the suspected exploitation to Adult Protective Services, APS, immediately. B. Help the client gather evidence of the financial exploitation. C. Discuss the client's options, rights, and the potential benefits and risks of reporting, while respecting their autonomy. D. Confront the adult child about the financial exploitation. Answer: C. Discuss the client's options, rights, and the potential benefits and risks of reporting, while respecting their autonomy. This question tests your ethical obligation regarding elder abuse and client autonomy, focusing on the first action. While financial exploitation of an elderly person is a serious concern and often falls under mandated reporting, the first step is to empower the competent adult client. The social worker should explain the reporting process, the client's rights, and the potential outcomes of reporting to APS, allowing the client to be involved in the decision as much as possible, unless their safety is immediately and severely compromised. For instance, the social worker might ask, "What are your fears if we involve APS, and what might be the benefits if we do?" Prioritize client autonomy and informed decision-making unless there is an imminent threat to life. Question 11. A client reports experiencing persistent low mood, loss of interest in activities, significant weight gain, and difficulty sleeping for the past 6 weeks. Which of the following conditions is most suggested by these symptoms? A. Bipolar I disorder. B. Generalized anxiety disorder. C. Major depressive disorder. D. Schizophrenia. Answer: C. Major depressive disorder. This question is about recognizing common symptom clusters for mental health conditions. The client's symptoms: persistent low mood, anhedonia, loss of interest, changes in appetite, weight gain, and sleep disturbance, are classic diagnostic criteria for major depressive disorder, according to the DSM-5. Bipolar I disorder involves manic or hypomanic episodes, generalized anxiety disorder is characterized by excessive worry, and schizophrenia involves psychosis. For example, consistent low mood combined with physical symptoms like sleep and appetite changes strongly points to depression. Remember, significant changes across multiple domains of functioning for a sustained period often indicate a mood disorder like major depression. Question 12. A social worker is working with a family where the parents consistently undermine each other's parenting decisions, leading to behavioral issues in their children. What is the best initial focus for the social worker in family therapy? A. Directly confront the children about their misbehavior. B. Teach the parents specific disciplinary techniques. C. Facilitate communication and collaboration between the parents regarding parenting roles. D. Refer the children to individual therapy. Answer: C. Facilitate communication and collaboration between the parents regarding parenting roles. This question addresses family systems and intervention strategies, asking for the best initial focus. When parents undermine each other, it creates an inconsistent and often chaotic environment for children. The most effective initial intervention is to strengthen the parental subsystem by improving communication and helping them establish a united front regarding parenting decisions. This foundational change is likely to have a broader positive impact on the children's behavior than focusing solely on the children or on specific techniques without addressing the underlying parental discord. For example, helping parents agree on a consistent bedtime routine and how to enforce it together. Always start by strengthening the primary relationships in the family system, especially the parental unit, when their issues are impacting the children. Question 13. A client presents with extreme paranoia, disorganized speech, and believes the government is actively monitoring their thoughts through their television. The client has no history of substance abuse. What is the next step for the social worker? A. Challenge the client's delusions directly to reorient them to reality. B. Document the symptoms and refer the client for a psychiatric evaluation. C. Focus on developing coping skills for managing paranoia in daily life. D. Explore the client's childhood history to identify root causes of the paranoia. Answer B. Document the symptoms and refer the client for a psychiatric evaluation. This question addresses working with clients experiencing psychosis and what the next logical step is. When a client exhibits severe symptoms of psychosis, paranoia, delusions, disorganized speech, without an obvious substance-related cause, the priority is to ensure they receive a thorough psychiatric evaluation for diagnosis and potential medical management. Social workers do not diagnose conditions requiring medical intervention but refer to appropriate professionals. For example, a social worker should not attempt to treat severe delusions through talk therapy alone but ensure the client sees a psychiatrist for potential medication. Always prioritize referral to the appropriate medical professional when severe mental health symptoms that require medical assessment are present. Question 14. A client reports feeling overwhelmed by recent job loss and expresses sadness, but denies suicidal ideation. The client states they often cope by engaging in intense exercise. This behavior is an example of which defense mechanism? A. Reaction formation. B. Undoing. C. Sublimation. D. Regression. Answer C. Sublimation. This question tests your understanding of defense mechanisms. Sublimation involves channeling unacceptable impulses or emotions into socially acceptable and constructive behaviors. In this case, the client is taking the overwhelming feelings and sadness from job loss and transforming them into a productive outlet, intense exercise. This is a healthy and adaptive defense mechanism. Reaction formation would be expressing the opposite emotion, undoing involves symbolically negating a previous unacceptable act, and regression means returning to an earlier developmental stage. For example, if a person with aggressive tendencies becomes a successful boxer, that's sublimation. When a client channels difficult emotions into a healthy, productive activity, it's typically sublimation. Question 15. A social worker is preparing to terminate services with a client who has successfully met their treatment goals. What is the most important step for the social worker to take during the termination phase? A. Discuss the client's future needs and how to maintain progress independently. B. Schedule regular follow-up appointments to ensure sustained progress. C. Refer the client to a new therapist to prevent relapse. D. Focus on celebrating the client's successes without discussing future challenges. Answer A. Discuss the client's future needs and how to maintain progress independently. This question focuses on the termination phase of treatment and asks for the most important step. The primary goal of termination is to empower the client to maintain their gains and function independently after therapy. This involves reviewing the skills learned, identifying potential future challenges, developing a plan for managing them, and discussing available community resources. For example, creating a maintenance plan that includes self-care strategies and identifying natural supports. The aim is to equip the client for continued growth outside of the therapeutic relationship, fostering self-reliance rather than dependency. Question 16. A social worker observes a 3-year-old child in a playroom who is primarily engaged in parallel play, interacting minimally with other children, and has limited verbal communication. The child's parents express concern about the child's development. What is the first action the social worker should recommend? A. Enroll the child in a social skills group. B. Suggest a full developmental screening and assessment. C. Advise the parents to encourage more verbal interaction at home. D. Refer the child for speech therapy immediately. Answer B. Suggest a full developmental screening and assessment. This question involves child development and assessment, specifically identifying the first recommended action. While parallel play is typical for toddlers, limited verbal communication and parental concerns at age 3 warrant a comprehensive developmental screening. This broad assessment helps to identify potential delays across various domains, e.g., communication, social, motor, and can guide appropriate referrals for specific interventions like speech therapy or occupational therapy, rather than immediately jumping to a single intervention. For example, a screening might reveal delays in multiple areas that require a multidisciplinary approach. Always recommend a comprehensive developmental screening first to get a full picture of the child's needs. Question 17. A client reports that their partner often makes them feel worthless, isolates them from friends and family, and controls their finances. The client also expresses fear for their physical safety. What is the first concern for the social worker? A. Developing a plan to improve the partner's communication skills. B. Helping the client understand the dynamics of emotional abuse. C. Assessing the immediate risk of harm and developing a safety plan. D. Encouraging the client to seek legal counsel for divorce proceedings. Answer C. Assessing the immediate risk of harm and developing a safety plan. This question deals with domestic violence and safety, asking for the first concern. When a client expresses fear for their physical safety alongside other forms of abuse, emotional, financial, isolation, the paramount and immediate priority is to assess the level of danger and collaborate with the client to develop a comprehensive safety plan. This plan might include identifying safe places, emergency contacts, and ways to leave an abusive situation. For example, discussing where the client can go if they need to leave quickly and who they can call. Always prioritize the client's immediate safety and well-being above all other interventions in situations involving abuse and threats to physical harm. Question 18. A social worker is assigned to a new client who expresses strong religious beliefs that differ significantly from the social worker's own. What is the best approach for the social worker to take? A. Gently challenge the client's beliefs to introduce new perspectives. B. Avoid discussing religion altogether to prevent conflict. C. Acknowledge and respect the client's spiritual beliefs as a potential resource and integrate them into treatment planning if appropriate. D. Refer the client to a social worker who shares their religious beliefs. Answer C. Acknowledge and respect the client's spiritual beliefs as a potential resource and integrate them into treatment planning if appropriate. This question addresses cultural competence and client-centered practice, asking for the best approach. A social worker must always respect and value a client's religious and spiritual beliefs, recognizing them as potential strengths and resources in their healing journey. Instead of ignoring or challenging them, the social worker should explore how these beliefs can be incorporated into goal setting and coping strategies, enhancing the therapeutic alliance. For example, a social worker might ask, "How does your faith help you cope with challenges?" Always approach a client's belief system with respect and seek to understand its role in their life and potential for support. Question 19. A 7-year-old client experiences significant anxiety whenever separated from their primary caregiver, often refusing to go to school or sleep alone. These symptoms have persisted for over 6 months. Which of the following conditions is most likely indicated? A. Attention deficit/hyperactivity disorder, ADD. B. Oppositional defiant disorder, OD. C. Separation anxiety disorder. D. Social anxiety disorder. Answer, C. Separation anxiety disorder. This question tests your knowledge of child mental health conditions, specifically identifying the most likely diagnosis. The key symptoms described: significant anxiety related to separation from a primary attachment figure, refusal to go to school or sleep alone, and persistence for over 6 months, are characteristic of separation anxiety disorder. ADHD involves inattention and hyperactivity, ODD involves defiance, and social anxiety disorder relates to fear of social situations. For instance, a child constantly worried that something bad will happen to their parent if they go to school is a clear sign. When a child displays excessive distress specifically related to being apart from a primary caregiver, think separation anxiety disorder. Question 20. A social worker is providing services to a client who recently lost their job and is struggling with feelings of worthlessness. The client states, "I'm such a failure, there's no point in even trying to find another job." What is the best response using motivational interviewing principles? A. You're clearly depressed. We should explore medication. B. It sounds like you're feeling discouraged and unsure about your next steps. C. Many people lose jobs, you just need to try harder. D. Let's list all the reasons why you are not a failure. Answer, B. It sounds like you're feeling discouraged and unsure about your next steps. This question assesses your understanding of motivational interviewing, asking for the best response. The core of motivational interviewing is to express empathy and reflect the client's feelings and statements without judgment. This response validates the client's feelings of discouragement and uncertainty, showing that the social worker is listening and understanding, which helps build rapport and encourages the client to explore their own motivations for change. For example, instead of challenging or fixing, you're reflecting their internal state. Always reflect the client's feelings and statements to build rapport and demonstrate empathy, rather than directly challenging or advising. Question 21. A social worker is documenting a critical incident involving a client exhibiting escalating aggression towards staff. What is the most important aspect to include in the documentation? A. The social worker's personal feelings about the client's behavior. B. Detailed, objective observations of the client's behavior and interventions used. C. Speculations about the client's underlying motives for their aggression. D. A list of all staff members present, including their home addresses. Answer, B. Detailed, objective observations of the client's behavior and interventions used. This question emphasizes the principles of professional documentation, asking for the most important aspect. In a critical incident, documentation must be objective, factual, and comprehensive, detailing what happened, what interventions were used, and the client's response. This ensures accountability, supports continuity of care, and provides a clear record for legal or administrative purposes. For instance, instead of writing, "Client was angry," write, "Client yelled, clenched fists, and stated, 'I'm going to hit you,' followed by staff de-escalation." Always prioritize factual, objective descriptions of behavior and actions taken in professional documentation. Question 22. A client diagnosed with bipolar II disorder reports taking lithium as prescribed but states they are experiencing increased thirst, frequent urination, and a slight tremor in their hands. What is the next action the social worker should take? A. Advise the client to stop taking lithium immediately. B. Document the side effects and tell the client they are normal. C. Encourage the client to contact their prescribing physician to report these symptoms. D. Suggest the client drink more water to alleviate the thirst. Answer C. Encourage the client to contact their prescribing physician to report these symptoms. This question tests your knowledge of medication management and interdisciplinary collaboration, asking for the next action. Increased thirst, frequent urination, and tremor are common side effects of lithium, but they can also indicate lithium toxicity, which can be serious. As social workers, we do not prescribe or manage medication, but we are responsible for monitoring for side effects and ensuring the client communicates these concerns to their prescribing medical doctor. For example, the social worker might say, "It's important to let your doctor know about these changes so they can check your levels and adjust your medication if needed." Always refer medication-related concerns to the prescribing physician or psychiatrist for proper medical assessment. Question 23. A social worker meets a new client who identifies as transgender and is seeking support for gender transition. The social worker realizes they have limited experience working with transgender individuals. What is the best action for the social worker to take? A. Immediately refer the client to another social worker with more experience. B. Educate themselves on transgender issues, seek supervision, and continue working with the client if competent. C. Inform the client that their agency does not specialize in this area. D. Focus only on the client's non-gender-related issues. Answer B. Educate themselves on transgender issues, seek supervision, and continue working with the client if competent. This question addresses cultural competence and ethical practice when encountering an unfamiliar client population, asking for the best action. Social workers have an ethical obligation to ensure competence. When faced with limited experience, the most appropriate response is to proactively seek education and supervision to develop the necessary knowledge and skills, while continuing to provide services if the social worker can competently do so. This demonstrates a commitment to learning and meeting the client's needs rather than immediately deflecting or ignoring critical aspects of their identity. For example, the social worker might attend training on gender-affirming care and discuss the case in supervision. Always commit to ongoing learning and seek supervision when working with client populations where you lack specific expertise. Question 24. A social worker receives an urgent call from a distraught parent stating their 15-year-old child is refusing to leave their room, threatening to run away, and expressing feelings of hopelessness after a breakup. What is the most critical initial assessment the social worker must make? A. The child's history of past relationships. B. The parent's ability to cope with the child's distress. C. The child's risk of self-harm or harm to others. D. The family's communication patterns. Answer C. The child's risk of self-harm or harm to others. This question focuses on crisis assessment, specifically identifying the most critical initial assessment. When a minor expresses feelings of hopelessness and threatens to run away, coupled with refusal to leave their room, the immediate and paramount concern is to assess for any imminent risk of self-harm or harm to others. This assessment would involve directly asking about suicidal ideation, plans, and access to means. For example, asking the parent if the child has ever expressed a desire to hurt themselves or has access to anything that could be used for self-harm. Always prioritize assessing safety and risk when a client, especially a minor, exhibits signs of severe distress and potential danger. Question 25. A social worker is meeting with a new client who expresses a strong desire to quit smoking but frequently states, "I know I should, but I just can't." According to the trans-theoretical model, stages of change, which stage is this client most likely in? A. Pre-contemplation. B. Contemplation. C. Preparation. D. Action. Answer B. Contemplation. This question tests your understanding of the trans-theoretical model, stages of change. The client's statement, "I know I should, but I just can't," indicates an awareness of the problem and a desire for change, but also a significant ambivalence or hesitation. This internal conflict between wanting to change and struggling with the commitment is characteristic of the contemplation stage. Pre-contemplation involves no intention to change, preparation involves planning for change, and action is actively making changes. For example, a person thinking, "I really need to start exercising, but I'm just so tired after work," is in contemplation. When a client shows both an awareness of a problem and ambivalence about changing it, they are typically in the contemplation stage.